May I introduce myself? I have been working in that neonatal intensive care unit 20 years. I'm intensive care specialist, and today we have an interesting topic about markers of cardiac dysfunction in newborn with intraamniotic infection. Neonatal infection are one of the main causes of morbidity and mortality. Therefore, their timely and accurate diagnostic is a very important task. For the purpose of early diagnostic of infection, various biomarkers reflection damage to target organs, which is the cause of the development of multiple organ dysfunction, have increasingly been used. Presepsin, adrenomedulin, and anti-inflammatory cytokines are considered as markers of the infection process, but the discussion about the diagnostic and prognostic significance of their markers haven't stopped to this day. One of the earliest clinical manifestations of intraamniotic infection in newborns is arterial hypertension, shock, and cardiovascular dysfunction. However, such symptoms may be noted in other critical conditions, which indicates the need for early differential diagnostic of the cause of circulatory insufficiency. Natriuretic peptides are one of the modern markers of heart failure, but there are few studies of their diagnostic value in newborns. In a study conducted in Portugal, newborns with persistent ductus arteriosus related NT-proBNP can be used in the diagnostic and management of PDA, as it has a good correlation with diagnostic, treatment, and prognosis. The authors studied 100 newborns with and without infection. They used a natriuretic propeptide in combination with therapy. Based on the result obtained, they revelated the natriuretic propeptide has high sensitivity and specificity in the diagnostic of myocardial lesion in newborns with severe infection. In most cases, the NIAMOD and neonatal SOFA scales are used in routine clinical practice to assess the severity of multiple organ dysfunction in newborns. It seems promising to study the concentration of markers of myocardial damage in combination with an assessment of the severity of multiple organ dysfunction using these scales. This may allow us to assess the severity of damage to the cardiovascular system and make the right decision about its medical correction. In one of the studies conducted at the Perinatal Center in Moscow, newborns with heart defects were examined. They examined the level of natriuretic propeptide on first and on 7th day the treatment of patients with inotropic drugs. As we can see from the diagram, the markers level on first day was significantly higher than after treatment in the intensive care unit. The blood levels of the N-terminal fragment of natriuretic propeptide is a highly sensitive indicator of the state of the cardiovascular system and in particular a markers of circulatory insufficiency in newborn. The concentration of the natriuretic propeptide correlated with the degrees of heart failure and the presence of persistent pulmonary hypertension. A decrease in the concentration of the N-terminal fragment of natriuretic peptide, again the background of drug compensation for signs of heart failure can serve an additional criterion for the effectiveness of therapy. The aim of our study was to assess the presence of cardiovascular dysfunction in newborns with intraamniotic infection who need treatment in neonatal intensive care unit. The characteristics of the patient are presented in the table. Prospective significant sensor observation study included 55 newborns with intraamniotic infection. There were 90 full-term and 36 preterm infants. Mean Apgar score in the first and 5 minutes of life was 7 points. Mean birth weight was 2,220 grams. Depending on the need for inotropic support, the children were divided into two groups. Group 1 included newborns in need of constant infusion of catecholamines. In group 2, drug support for hemodynamic wasn't required. For the purpose of drug correlation of hemodynamic disorders, dobutamine was used as a statin dose of 5 micrograms per kilo per minute. If necessary, the dose was increased by 5 micrograms per kilo per minute every 15 minutes until normal blood pressure levels were reached. monitoring of heart rate, non-invasive blood pressure, and pulsative hemoglobin oxygen saturation, Nemoth scale for evaluation of organ dysfunction, clinical and biochemical blood test, evaluation of acid-base balance, determination of biomarkers level CRP, PKT, and TPRBNP. The analysis was performed by immunochromatographic method with fluorescent detection on the ramp reader system device. The fraction of cardiac output in Group 1 children upon admission to the neonatal intensive care unit was low and amounted to only 60%, but on the third day of treatment it reached 69%. Laboratory examination indicators depending on the need of constant infusion of catecholamides. In children of first group, the level of natriuretic propeptide was higher than in newborns of 2 group, and against the background of treatment, it decreases by almost 2.5 times by the third day. When analyzing the treatment outcomes, it was found that Group 1 children needed long-term support of vital function and treatment in the neonatal intensive care unit. ROC analysis related the Nemoth score and the concentration of natriuretic propeptide have approximately the same value in prediction the duration of treatment in the neonatal intensive care unit and have no statistically significant differences. Conclusions: NT-proBNP is a highly sensitive marker of cardiovascular dysfunction in newborns with intraamniotic infection. A statistically significant direct correlation was revealed between the levels of NT-proBNP, PKT, CRP, neutrophil index, and Nemoth score in newborns with intraamniotic infection in need of inotropic support. A comprehensive interpretation of the concentration of corpusculatin, CRP, NT-proBNP, and of the Nemoth score allows up to determine the severity of the infection process and the severity of cardiovascular dysfunction. Separately, I would like to note that today there is no universal, highly sensitive and specific markers that allows ambiguously verify multiply organ dysfunction and determine the cause of its development. The diagnostic and prognostic significance of individual clinical and laboratory sites is rather small, which indicates the need for a comprehensive assessment of the clinical picture and all laboratory examination. Thank you for your attention.